This is Dr. Colley of Advanced Joint Replacement Center, and this is our first installment of our new video series, Orthopedic Fireside Chats. Today we're talking about frozen shoulder. This is one of the most common things I see in my office. Unfortunately, this can happen to anyone, but it's more common in patients with diabetes or a history of thyroid disease. What happens is the capsule becomes inflamed and then leads to tightness. This causes limited range of motion and pain, even with small movements. It can be very frustrating, but fortunately, most of my patients can avoid surgery. The first step is a gentle stretching program to slowly increase your range of motion. I don't like to get too aggressive with stretching and let you do it on your own. Many patients benefit from a steroid or cortisone injection to decrease pain and allow more efficient stretching. This problem can take a few months to a year to resolve, but if you're patient and diligent, you can get back to normal function. Visit our website or make an appointment for more detailed information.